Good evening, everybody. My name is Rosemary Aldrich. I'm the Medical Director of the Grampians Public Health Unit, and I'd like to welcome you tonight to this live stream of a panel of my colleagues. And tonight we're talking about all questions COVID. We're happy to take questions, as you know. I'd like to commence by acknowledging the traditional owners of the lands on which we meet and pay our respects to elders past and present. I'm calling tonight from Wadawurrung country in and around Ballarat. I know there are many tribal nations and their lands across our region of the Grampians, and we welcome all First Nations people here tonight. I'd like to introduce the panel and also say thank you to our Auslan interpreters who will be with us for the evening. So first of all, we have Dr. Rob Grenfell, who is a public health physician in the Grampians Public Health Unit. Rob is one of Australia's vaccine experts, and he'll be answering questions on any aspect of our COVID response, but particularly with respect to the vaccine. We've got Dr. Alicia Williams, and Alicia is a public health paediatrician, so a practicing paediatrician, as well as a member of the Grampians Public Health Unit team, and can answer questions on any aspect of our COVID response, as well as questions specifically pertinent to children. We've got Ms. Lisa Oro, and Lisa is the operations manager for the Grampians Region Vaccination program, and it goes without saying, can answer questions on the Grampians Region-wide vaccination program that's led and run by the public sector partners. So I'd like to commence by giving background to how we are travelling in the Grampians region. So this is a Grampians-wide forum. So the information I'll be talking about is about the Grampians region itself. So as of last night, we had about 2,700 active cases of COVID in our region. We think that the vast majority of those are Omicron, to the point where we think Delta is a rare strain now. And so because we're dealing with Omicron, that means we're dealing with a much, much more infectious variant. But at the same time, we know that the impact of Omicron is less, and that's partly because we've got such high levels of vaccination in our region. So a lot of people are getting it. We know that from the case numbers. About 400 to 500 a day that are being recorded as positive in our region. That's a combination of test results from the PCR swab, as well as people registering their positive rapid antigen test. So I'll also be talking a little bit about testing availability. So we do have testing centres across the region. These are listed on the Ballarat Health Services website and are listed on the Department of Health website. However, as you know, testing has been constrained by questions of queuing, and the demand has meant that in the past we've had long queues for testing. That's lessened to an extent. We've also had not the level of rapid antigen tests available for public use as we'd wish. So we do appreciate that not everybody can get a rapid antigen test as you would like. However, we do understand that is changing, and we know that the supply of rapid antigen tests is starting to flow, particularly to those critical industries at the moment. So that's health services and aged care facilities and people who need those tests for other reasons, as organised through testing centres when available. We also know that, of course, today, the Department of Health, the Premier yesterday, Acting Premier yesterday, announced that we would be commencing a code brown, a statewide code brown across metropolitan hospitals and each of the regional centres and the hospitals associated with the regional centres across Victoria. In our region, that's Grampians Health, which has campuses across the region in Ballarat, Stawell, Horsham, Dimboola and Edenhope. And accordingly, that means that the decision-making within Grampians Health is geared towards making sure that everybody in our region gets the care they need from a COVID perspective. So just because the code brown doesn't necessarily involve our other sub-regional hospitals, there's constant conversations across the health sector about how we can be working together to make sure the people of the Grampians get the care they need. That's a very brief summary of where we are today. We can answer further questions down the track, but what I'll do to begin with is hand over to Dr. Rob Grenfell to give us some information about what you can do if you or a loved one tests positive for COVID. Over to you, Rob.
Yeah, thanks, Rosemary, and it's great to have the opportunity to talk about the challenges we've got with COVID as it stands. What a journey it's been over the last 2 years, and the virus emerged sometime in the start of 2020 in Melbourne with one of the first cases that came to Australia, and from that period we've had a number of challenges that have occurred. Thankfully, we have effective vaccines that now work and actually cover this infection. And Lisa Oro will talk about what we're doing with the vaccines as to where they stand. But the important thing to stress is we have a number of vaccines. They are all safe. They are all very effective. And provided you actually get your booster dose and your third dose, we're finding from our experiences in our region that most people who contract COVID after having had 3 vaccines have a mild disease. It doesn't discount the fact that you could have more severe symptoms, but we are certainly encouraged, particularly in our aged care settings where we are managing active cases, that the residents that are contracting this virus, well, previously without vaccine or the previous variants, they were very grave outcomes from those infections. But at this stage, we're finding that mild disease is occurring after 3 vaccine doses. So we should be encouraged by that. So the rules keep changing, and that, of course, is because this is a new infection, and it is something that we are working on as to what are the best ways to deal with this virus when it occurs in our community. So I know that that can be frustrating, and I know that it can be challenging to actually keep up with what is the latest advice. So this advice is being tempered by, one, how much virus is circulating in the community, and also how many people are vaccinated. And I do thank the community here for being so adept at actually being vaccinated to the high levels, because that actually is giving our community a lot of resistance to this virus establishing itself. The other thing we've also learned is how do we test for this virus and what sort of tests we need to do. So many of us are becoming experts at, one, having our nose scraped, which is not a pleasant thing. And many of us are also now understanding what rat means. And I have actually said that 2022 will be the year of the rat, when all of us will be doing rats in our house, rats to go to work, and rats to work out whether or not we have COVID. That, of course, is if you can get your hands on one of those tests. Now, we have been assured that more of these tests will be available. At the moment, unfortunately, all we have available are tests to use in what we call sensitive settings. So these are in aged care settings, healthcare settings, and disability settings. And a number of workplaces also have a supply so that they can also look at doing these tests. But in the near future, we've been assured that we will have tests so that we can, one, perform these when we have symptoms or consider that we might have the virus. So at the moment, if you actually have symptoms of COVID, which can be quite mild, but if you actually do those and suspect you've got COVID, consider you have. And it's important that you isolate. You isolate and get a test. Now, the reason for this is by isolating, you're not going to spread it to as many other people. That's the important part. By getting the test, we would suggest the PCR test if possible to do that. And as Rosemary said, the capacity to do PCR tests has improved over the last few weeks since we have gone through that crisis point that we went through. So symptoms, isolate, PCR test. If you can't get a PCR test and you have got a rat test, doing a rat test is also an effective way of doing that. And many of us may find out that we actually do have COVID by doing a rat test. If you have a positive rat test, we regard that as meaning you have COVID and you need to isolate for 7 days. Now, why 7 days? Why not 10 days? We used to be 2 weeks. Okay, we know that you are infectious for a period of around about 5 or so days, and that by putting in the 7 days from the onset of symptoms or the positive test, whichever is first, means that you will not be infectious by the end of 7 days and safe to actually go back into the community. And this is where the complexity comes in. What about everybody else who lives in my house? And where do they stand? People who share the same house or household as a positive case are primary close contacts, and they are at very high risk for contracting the virus and also transmitting it. So they too need to consider, one, if they've got symptoms, obviously to test to see if they've got COVID, and will need to isolate too. On the other end, they need to isolate and for a period of 7 days as well from the time that the other person had that, and to clear themselves with a RAT test on day 7. Now, again, people will say, but the rules keep changing, and the answer is yes, they do. So the only way to keep up with these rules is to, one, look at our website and look at the state government's website, and try not to get as confused as it is so easy to do so in these circumstances. Now, there are many other complexities that I can add into that, but I don't think we'll move into those unless we get questions on where, what, and how. But the important thing is, when you have been diagnosed as having COVID, that you register that positive result on the state government website. Now, there's a good reason for that, because if you were to get unwell, and you will actually be getting questionnaires to fill out, which will be sent to you either as SMSs or emails or otherwise, is that we need to know who's sick in the community, because if people can deteriorate quite rapidly and may need hospitalisation, and these people need to actually be channelled into the care pathways when it's appropriate. Now, I have said that the vast majority of us who are fully vaccinated will have very mild disease, and that's fine. You manage yourself at home, and there's lots of tips on the state government's website and links from our website on what to do when you're positive, particularly with mild disease. It may be just feeling unwell for a couple of days. It may, in fact, be up to 3 days or so in bed, feeling absolutely awful. But it's very unlikely, if you're fully vaccinated, that hospitalisation will occur. However, as I've said, if the symptoms actually do deteriorate, and again, the advice is on our website as to what is mild, moderate, and severe disease, and most importantly, difficulty breathing, and also much higher fevers, are some of the symptoms that we're actually interested in, because they themselves can indicate severe disease and the potential need for hospitalisation. Now, the good news is that if you actually do get hospitalised, there are now a number of effective treatments that we can start to minimise the severity of the disease. And there are many more treatments coming through the pipeline to assist that. So there is a lot of positive news there in that sort of setting. Now, the other question I get a lot of is, what about other variants that are coming through? And the answer to that is, yes, COVID is not stable at this stage. And we are certainly anticipating that there will be another variant coming through, which means, yes, we will need further booster doses in some time into the future. And again, good news there is that there are many vaccines. At last count, somewhere over 200, nearly 300 other vaccines in trials at the moment globally that are looking at countering multiple variants of the virus as they emerge. So we should not despair at this stage, but we should keep alert as to what's going on. So I'll stop there and hand back to Rosemary for further there and welcome questions as the time goes on.
Thanks very much, Rob. I have a couple of questions for you, and then I'll move on to some other questions. So please keep those questions coming. We're here to answer the questions to the best of our ability. Any questions that we can't answer tonight, we'll take on notice, and we'll make sure that we post answers on the Facebook page. So a question for you, actually a series of questions for you, Rob Grenfell. I'll just start with one, which is, how soon can I be vaccinated after I test positive for COVID?
So the current recommendation is, if you are over the disease and symptomatically well, get vaccinated with the dose if you're due for the next dose. And that will give you a good coverage against the long COVID symptoms, and also prevent you from actually getting reinfected, because the terrible problem is that having had COVID once doesn't mean you're not going to get it again. But vaccine does decrease the chance of actually contracting it again.
Thanks. More questions for you, Rob. And this comes from an attendee, and it's a bit of a long one, so I'll read it out and I can repeat it if you need me to. I have tested positive to COVID-19 and have had a second PCR test 14 days later and again tested positive. Is it true that I can keep testing positive for up to 3 months? Do I need to keep isolating until I test negative? My mother is currently undergoing treatment for cancer. When would it be safe for me to visit her?
Thanks so much for this question, because this is a very common question that we all have. So let's just start with the PCR test, what it's testing for. The PCR test is testing for components of the virus. It doesn't tell us whether or not the virus is actually alive or in fact capable of infecting people. And people can shed viral components for anywhere up to a few weeks after the infection, and some have even gone on for a good month. Now, that's why we've stopped doing tests after people have passed the convalescent period. So let's be clear. You have the diagnostic test at the start that says you now have COVID. After the end of the 7-day period, we regard you as non-infectious. You're allowed to go about your usual business. We do not suggest repeating PCR tests anytime in that period after that, because invariably for many people, they may become positive, and that's confusing. So in the first instance, yes, you could keep testing positive, probably not for 3 months, but certainly up to a month after you've had COVID. So please don't do the tests, because they're not any help whatsoever. Now, I totally agree that having loved ones who've got immune compromise, and all of us have got them. I myself have aged parents who have impaired immune systems. And the important thing is that your loved ones have been vaccinated. And even though you've got cancer and cancer treatment, it's very important that you're up to date with the vaccines and the boosters, so that your mother has the best way of actually fighting off or fending off the infection if she were to be exposed to it. The other thing that I would suggest is for loved ones who have impaired immune systems is wear a good fitting mask when you visit them. And that in fact actually is the best way of actually limiting the chance of you spreading anything to them anyway. So those two things: one, mum should be vaccinated to the regular schedule, and you should be wearing masks when you're with her in that sort of setting. And I know how much we like to actually hold our loved ones, particularly at challenging health times. One of those is to limit that close contact, and also limit that close contact in rooms as well, so sharing tight spaces. So I know that is hard to take at these times, but is also another way that you can actually provide the safest sort of situation for your mother.
Thanks, Rob. I might add a little to that answer, which is there was another bit to it which I may have missed, which was, do I need to keep isolating until I test negative? The answer is no. So after 7 days, after that first test, the day you've taken it, we regard you as no longer infectious. And if you keep on testing, as Rob has explained, it may well be positive, but that's fragments of virus that are being found there. That doesn't mean you can transmit it to someone else. And the other thing about protecting our loved ones with potentially diminished immunity, in fact, is also to make sure we're vaccinated ourselves, so that if we do get COVID, we're getting it for a very shortest amount of time. We're not particularly sick. We're certainly not, we're much less likely to get COVID, so therefore being with someone while we're asymptomatic potentially. So the best protection we can have for the people around us is for ourselves to be vaccinated. And of course, in the Grampians region, we have tremendously high rates of vaccination. And we're moving into the boostering program, and we're having high rates of boostering of our eligible populations. And I might just ask Lisa Oro, how are we going with our booster program and the proportion of people who are eligible, which has increased again after announcements this week?
We are doing very well both across the whole region for vaccinations. We've actually vaccinated over 200,000 across the Grampians region. And the booster program, we're actually leading the state in our region at 31% of all eligible for the booster program. So we're actually doing very, very well.
Thanks, Lisa. I might just point out that 200,000 figure is the number of doses in people's arms done by the public sector. And for the most part, that's been matched also by the fantastic work by general practitioners and pharmacists also. So it's been a tremendous effort. Given our population is around the 260,000 mark, it just shows and reflects then in the 95% rates of double vaccination that we've had. And now if we add that, I think it's 57,000 vaccinations that have been given across our region for boosters, then you can see that we're well on the way to actually achieving our goals for boostering. And Lisa, another question to you around the vaccinations for 5 to 11s, which only started 10 days ago. Can you tell us a bit about how that's been going, the experience we've had in Ballarat and across the region?
It's been a very well received program. We were booked out in the first week, and this week was booked out as well. But we do have lots of bookings available for those that are still interested the week commencing the 31st of January, and we'll be opening bookings for the week commencing the 7th of February tomorrow. It's not just the state-run clinics that you can access this vaccination. You can through your GP and pharmacy as well. Some towns don't have a GP or pharmacist operating, so we are working with our sub-hubs, Ararat and Horsham, to make sure we can set some pop-up clinics for that population that are hard to access. So bear with us while we do it. We'll be doing that over the following week, but there are lots of opportunities to access that vaccination for families that are keen.
And we've heard a bit about how the vaccine centre and the vaccine centres have been set up to make them welcoming for children. Can you tell us a little bit about that, please?
We have the Enchanted Forest theme. So when families come in, and we do offer parents that attend with their 5 to 11-year-olds if they would like to have a booster vaccine at the same time, but it's an Enchanted Forest theme. So they get a leaf with their name on it, and that carries them through into the Enchanted Forest. There are Australian animals and little stories around our Australian animals to distract them. There's buzzy bees, there's fidget spinners, and there's colouring books, and they get a little jab done pack that they carry with them through. There's hopscotch that they can go through once they've had their vaccine, and then they can place that leaf that they've been given on a tree where they can actually see all the other children that have had their vaccines, and it's been really well received.
Can you give us some examples about the comments you received from children and parents in relation to that experience?
It's been very, very popular. So they really enjoy the Australian theme and the Enchanted Forest. They feel very, very welcomed. We also have a low sensory clinic here, which we'll try and replicate across the region for those that may feel it's a bit overwhelming. We're working with our disability liaison officers to offer that service for the children that might find it a bit much to come into such a high sensory space. So we've recognised that, and we will be starting those on Fridays, and we'll work with our regional towns and service providers to offer a similar service. But yeah, very, very well received and very popular. Loving the show bags that they're getting, the jab done bags and the little gifts that are in them.
Thanks very much, Lisa. Some questions for Alicia, our public health paediatrician. And here's a series of questions for you, Alicia. First of all, in relation to COVID, what symptoms do I look for in my children? You're on mute, Lisa.
Thanks, Rosemary. I'll break this into 3 sections. The first being, what should you look for in the acute infection? So when your child actually has COVID-19, we know that some children are asymptomatic with COVID-19, they may show no symptoms whatsoever. Others, and the majority of kids, will have a mild illness. And that can look like a common cold. So cough, runny nose, sore throat, headache, a bit lethargic. It can also look like a gastro-like illness, so vomiting and diarrhea, or it can look more flu-like, high fevers, body aches and pains, cough. And it can look like a combination of all of those things. So any of those things can indicate that your child has COVID-19, and they should have a test, just like an adult should, to confirm their infection. The next thing that I'll talk about is what you should be looking for in terms of what we call red flags or warning signs. So as a paediatrician, this is what we commonly look for if children are coming into our clinic or into the hospital. And these are signs that your child may have more severe illness or may need to come into hospital for treatment, either with oxygen or fluids. So some of those warning signs to look for would be that your child is having difficulty breathing. That may look like fast breathing. It may look like they're using extra muscles to breathe. So their nostrils might be flaring with each breath, or they might have little divots in between their ribs as their muscles are moving in and out with each breath. They might have chest pain. So any severe chest pain or severe abdominal pain that does not settle with your usual Panadol or Nurofen is worth getting checked out. If your child is dehydrated, so if they're not drinking well, and by drinking well, I mean anything that contains fluids. So not all children will want to take a bottle, but they may take small, frequent amounts of fluid. It may be juice, water, an icy pole, purees. The little sachets of purees can be quite handy, particularly for the smaller kids. But if they're not taking their usual amount of fluids and they're starting to have decreased urine output, so they're not weeing as much or they're having dry nappies, that's another reason to get checked out.
Okay, thank you very much. Is there more, Alicia?
I'll just say the third thing is in children, there is a rather unique phenomenon. It can happen in adults, but it's much more common in children that parents need to be looking out for after children have COVID. So this is something called PIMS, TS, or MISC, which basically is an inflammatory process that can happen between 2 and 6 weeks after a child has COVID. Typically happens around the 4-week mark. Most common in the 8 to 9-year-olds, but can happen anywhere between around 5 and 13 and to a lower extent outside of those age ranges as well. And that's where your child will present as looking unwell. They will have a recurrence of their fevers, and they may get other things like red eyes, red lips, cracked lips, red or swollen hands and feet, and swollen lymph nodes in their neck. So if your child presents rash and abdominal pain can also be part of that process. If your child presents with that sort of picture a couple of weeks after having COVID, you should seek urgent medical attention and get them checked out to make sure that they do not have this inflammatory condition. Children with this inflammatory condition do need to be hospitalised in the vast majority of instances, can need ICU care. So it's really important to keep an eye out for that. Although it is uncommon, it's something you need to look out for.
So that leads me on to my next question to you, Alicia, which is, I know a number of children who are not vaccinated have tested positive to COVID, but they don't show symptoms. Do I really need to get my 10-year-old vaccinated?
Yeah, so this is a really good question, and one I get asked a lot, because you can have asymptomatic infection in children. And we know that overall in children, it does tend to be a milder condition. However, there is still a reasonable minority of children that will need hospitalisation and some that will need ICU, and in rare cases, deaths. The direct benefits of vaccination for children are that it reduces the incidence of infection, and this data was based mostly on Delta infection. We're still to see what will happen with Omicron, but by about 90% it reduced infections when they did the initial trial with the 2,000 kids with Pfizer, and in this sort of 5 to 11 age group. So that's a significant reduction in infections. That will help kids stay well. It will also help their families, their friends, their loved ones stay well. And what is yet to be seen, but what is hoped, is that it will mean that kids can stay in school and they can keep engaged in the activities that we know are really important for their mental health and their general well-being, including in the education sector. So it's a decision that each family needs to make for themselves, but we do recommend it. The appropriate experts have looked at the vaccine and have found it to be safe and effective, and therefore recommended.
Thanks very much, Alicia. A question for you, Lisa, from an attendee. I can't find appointments for my children to get vaccinated before they start school. Can I send them back to school with no vaccination or only 1 dose?
Yes, they can. They can, and we are trying to get as many bookings open as we possibly can. For those children that we find where bookings are difficult, we are going to work with the Department of Education to offer some pop-up clinics at schools. There's been 30 that have been identified as high target, and Yule Park is one of those, and we are working closely with Yule Park to run a clinic. But yes, your children can go back to school before they're vaccinated. But we'll work very hard to make sure that we get doses available and vaccinations in arms as quickly as possible.
And Lisa, before you go, With respect to vaccinations for children across the region, I'm sure you're working on that. So can we tell our attendees a little bit about the work you're doing to make sure we've got vaccine clinics across the region for our children?
We're working closely. As it's still very new, we commenced last week, so we have to make sure that our staff are trained and they are signed off to to provide a vaccination. We make sure that they have anaphylaxis training and all the training that goes in the background. So we're working closely with services that may not be offering it just yet, but working towards offering it, and obviously having a workforce that can deliver. We want to set up so the clinic is really a friendly space for children to walk through. So it does take a little bit of time, but we are working across all those smaller regions that may not be offering clinics just yet, but we're working with them to get them up and running.
Okay, thank you, Lisa. Some questions for you, Rob. So what symptoms can I expect from my booster dose?
The symptoms are quite varied from your third dose of the vaccine. They can be none at all, right through to having some aches and pains, or even in your muscles, or at the site of the injection, or in the lymph glands in your armpit. I myself certainly had 2 to 3 days of just not feeling the best after I had my third dose, but I know that those symptoms are vastly less than what COVID would be like if I was to have that. And certainly at my tender age, Rosemary, COVID can be quite a severe disease. So the answer is probably none, but you might get some mild pain and aches in the muscles on the side of the vaccine.
Thanks, Rob. And another question for you, which is from an attendee, and this is quoting the question: a COVID positive friend declined to accept government assistance after testing positive because they didn't want to add additional pressure to the system. What can I advise her for best action? She has some underlying health issues.
So the government has been very generous for people who have contracted COVID. And as more and more of us get it, there are many of us that don't need assistance because we're certainly well prepared and well set up at home. But for those members of our community that are finding that the disease is actually challenging them for perhaps getting food delivered to the house, or in fact actually even some type of other benefits that they may need, by linking in with the government services, you will in fact actually be assisted where appropriate and relevant. And that's the important reason for when you're positive, to make sure that you actually register your positive result with the government website. Now, it's very noble for somebody to say that they don't want to clog up the system, but this system has been designed to assist people. So I would be stating that it is designed to help people such as your friend, and so they shouldn't feel too bad about, in fact, actually availing themselves of any assistance.
Thanks very much, Rob. I might add to that by saying how important it is that we are gearing our whole health system as well in terms of being able to care for the people who need care, and also, of course, to be doing that with, like every other industry, fewer staff, because indeed our staff have become exposed, infected, and sometimes our household contacts also. So there's many, many, many thousands of people who are working towards making sure that those of us who can are supporting the rest of the community who need our care. Another question for you, Rob. I had a PCR test last week but have not had my results. Does this mean that as I have been isolating for the whole week, then do I have to do another week isolating until I get my result?
Yeah, this is such a common problem. And we even found that when we had the big squeeze on PCR tests and the delay in the results, that some people were finding that their tests had to be repeated. Now, that was a very unfortunate state of affairs, but at the moment, it's unlikely that you're going to get that 1 week delay in the way that we're working, but it's still possible. And we are working towards making sure the system is as timely as possible. So how we would break this down is from the start of your symptoms, and also is deemed the time that you were actually infected. That is, if you actually did have COVID. So it's still of interest to see what that PCR result is. And if you can get access to a RAT, if you still have symptoms, a RAT test would be a good proxy to do in this case. However, if the PCR comes back and says you're positive after having isolated from when the test was taken 7 days ago, technically you've finished your quarantine period. So you can go about your way and know that you've actually had the COVID and recovered. So that's the way I would look at that. I hope that's clarified that point.
I agree, Rob. It's as if the test result had come back the following day after someone had it, in which case they'd be doing their isolation and finish their isolation on day 7 and do not need to keep on isolating just because their test result hasn't come back. And of course, if the test result comes back negative, then whatever symptoms you had, whatever virus you might have had, you've kept other people safe by keeping away from them in any case. So you've done absolutely the right thing. A question for you, Alicia. An attendee has said they're concerned about the potential long-term effects of the vaccination on their 5-year-old. What can we say to them?
Yeah, so this is a common concern that I hear from parents. So the recent surveys of parents have showed that about 80% of parents are really keen to get their kids vaccinated, but there's about 20% who are quite hesitant or have questions, and particularly around the long-term effects. What we know about the effects of the COVID vaccine in the short term are that most kids will have little to no side effects, and the side effects that they do have are typically local, so redness or pain in their arm. They may get a bit of a fever, they may get a headache, and they may be tired for a couple of days, and they usually pass. In the medium term, in older kids, so this is not in the 5 to 11 year age group, but in the 12 and older, there has been an increased incidence of a condition called myocarditis and pericarditis. And that means inflammation of the heart and inflammation of the lining around the heart, respectively. That hasn't been shown as yet in the studies of the 5 to 11-year-olds. So the initial trials were too small to detect such a rare side effect, but we've got really good real live data now. So America alone has vaccinated. They've had about 5 million kids in this 5 to 11 age group who have had 1 vaccine. They've got about 2 million kids who have had 2 vaccines. And that's the same number as our entire population of 5 to 11-year-olds in Australia. We've got about 2.3 million kids. So we're certainly watching the data out of the US and UK and other places that have started these vaccinations closely. But so far, that is not looking the same in the 5 to 11 group. So that's for myocarditis and pericarditis. In terms of the long-term effects, that will be monitored closely across the globe. I think with any vaccine, it's very rare to have long-term effects of a vaccine, and there's certainly nothing to suggest that in the literature to date. We know that some people are concerned about fertility. That's quite a common thing that comes up, and there is no evidence to suggest that there is impacts on fertility for either males or females who are having the COVID vaccine. What we do know for the long-term effect of COVID, and given it's only been around for a couple of years, again, the data is still pending, but for kids with COVID, they are at increased risk of that inflammatory syndrome, as I said. There is some who will get deep vein thromboses in their legs, and there's emerging evidence that kids who have recovered from COVID are at a higher risk of diabetes as well, so type 1 insulin-dependent diabetes. So while we're still watching for that emerging data over the longer term with the COVID vaccine, so far everything suggests that it is safe. And in fact, there is more emerging evidence of the potential risks of having COVID in your child in the long term.
Thanks, Alicia. Thanks, Alicia. Just we have got an attendee who has asked a question related to what you've just commented on, which is, my son has 2 daughters under 10 and is worried about problems later when they want to have children themselves. Can you reiterate the information around that for children and fertility, please?
Yeah, so there is no evidence to suggest that there is impacts on fertility. So the Royal Australian and New Zealand College for Obstetrics and Gynecology, who are the experts in this in Australia, and similar organisations throughout the world have all put out statements, which we can share in the chat, with the evidence so far that says that there is no link between the concerns around the vaccine and fertility. We also know that for women who are wanting to conceive or who are pregnant, it is safe and recommended that they get the vaccine at any stage in the lead up to or when pregnant to help protect both themselves and their babies against the complications of COVID that can occur in that perinatal period. So COVID can be a more severe illness for pregnant women, and it can cause complications such as preeclampsia. It can cause early delivery, and for the baby, that can cause quite significant morbidity, so illness around, particularly if they're born prematurely, and they can get COVID themselves. The other thing to note around that is that there is evidence that the antibodies, so the protective factors that are generated after your vaccine, can pass into the breast milk and can pass into the cord blood and probably provide some protection for the baby when they're born as well.
So Alicia, when is the best time for a pregnant person to be vaccinated?
As soon as they can.
Thanks. A question for you, Rob, a clinical question. Can the booster cause issues of the lymph nodes, such as enlarged and thickened nodes, in particular in the axillary region?
Yeah, the way that vaccines work is by stimulating your immune system, and your lymph nodes are the first stage of your immune system. So it's very common for people to have swollen glands. And there probably are many of you out there like myself that every time you have the flu injection, you actually end up with a great big red mark on your arm and also swollen lymph glands for sometimes up to a week. And then they settle down. So that certainly happens for me with the flu, and I know it happens to many of my patients when I gave it to them as well. And we're seeing the same with COVID. It's not guaranteed that the lymph nodes will swell, but they will swell in some people, and then they will also go down. Obviously, if there are persisting symptoms after this, that you do need to consult with your doctor, because it may be something else rather than the vaccine.
Thanks, Rob. Another question. If a person has tested positive to the virus, completes the 7-day isolation and is now asymptomatic, do they have to isolate if another household member then tests positive with the virus a week or so later? So this is a question about how quickly can I become reinfected with COVID? Yeah,
the beauty at the moment is if you've actually had COVID, we're actually deeming that in the next 30 days that it's very unlikely that you will contract COVID again. And so if this circumstance was to happen to you, you've finished your infectious period and you can move on with your life. But the other person will have to isolate for the 7 days from when their symptoms started or their test became positive. Now, at the end of that 30-day period, we've stated that, in fact, you could, in fact, be susceptible to catch COVID again. And we have definitely seen this with people who had Delta and then have actually contracted Omicron. So that's the reason why we have the 30-day limit now. It was a lot longer. Yes, I told you before we changed the rules. That's only because as we know more and more about this virus, we become more accurate with the advice that we're giving, or at least change the advice how it fits. So you're in a good position. If you actually have got over the COVID, you can go back to your normal business. And obviously you can care for your loved one who has COVID.
And how soon after I've had COVID can I get my booster?
As soon as you're feeling symptomatically well, that's when you should have your booster dose if it's due. So importantly, if it's due, you are able to do that. And it has been shown, and increasingly so, that by being vaccinated after having COVID decreases your chance of long COVID symptoms.
Thanks. And a couple more questions for Alicia. Alicia, the attendee who wrote about her granddaughters has also added that both of those daughters were born with a hole in the heart. So does that add anything to their risk, now that you mentioned the myocarditis?
So two sections. One is that we know for kids who have got underlying cardiac conditions, as well as underlying respiratory conditions, neurological conditions, metabolic conditions, they're at higher risk of getting COVID. And so for the vast majority, COVID vaccine is recommended. For people who have had myocarditis in the past, particularly in the recent past, they should seek the medical advice of their cardiologist or similar specialist before they get it done. And similarly, for the one with kids with holes in their heart, it depends on the cardiac manifestations of that. So I would recommend that they have a chat to their GP or their pediatrician or their cardiologist. But in most cases, it would be safe and still recommended But for those individual cases, I'd recommend chatting to a professional.
And of course, as you've already elaborated, a child with a cardiac history or any other chronic condition is at greater risk of the severe consequences of COVID. So could you elaborate on that, please?
Yeah, so kids who have got underlying medical conditions or cardiac, neurological, metabolic conditions, or obesity, which is something we commonly see in the adolescents who get really sick with COVID, or the adolescents with obesity, they're at a higher risk of having severe COVID infections. So not just having the cold symptoms, but getting those real difficulties with breathing, getting inflammation of their heart. So the myocarditis in particular can happen with the COVID infection itself, not just with the vaccine, and other complications through all the different systems in their body, requiring hospitalisation and ICU care. So again, it's not guaranteed that that is going to happen, but there is higher rates of needing hospitalisation and ICU care.
Thanks very much. Another question for you, Alicia. So what is the dosage interval for childhood vaccines for 5 to 11-year-olds? And will there be likely a need for a booster in the future?
Yeah, so for the 5 to 11-year-olds, it's a 10 microgram dose, which is a third of the dose that's given to the kids who are 12 and above and to adults. And the reason for that is they found that at that smaller dose, kids were still able to generate a really great immune response. So they're still protected at that small dose with the same or less side effects as if they had the larger dose. So it's 10 micrograms and it's given 8 weeks apart. So you may see that in some countries, and in the initial study, it was given 3 weeks apart. The reason Australia, as well as many other countries, including Canada, has chosen the 8-week interval is that it has the potential to provide better immune response and better immune coverage, and that's based on adult studies, and also may reduce the risk of myocarditis if there is an increased risk there, because studies of adolescents and young adults with myocarditis have shown that if you have the vaccine with an interval between your doses of less than 30 days, you have a higher risk of getting myocarditis than if you have an interval 8 weeks or over. So that's why it's 8 weeks apart.
Thanks very much, Alicia. A couple more questions for you, Rob. First is, if I test positive for COVID, what sort of support can I expect at home, either from healthcare or from other sorts of needs of daily living?
So once your case is notified to the public health unit, it's determined as to what type of services you actually may need. So most of us are fairly self-sufficient and can in fact actually deal with the week's isolation by ourselves. But there are many members of our community that can get assistance with supply of food in that particular setting, or even supply of their essential medications and other things. Now, this is really done on a as needs basis, and it is coordinated and delivered by our very diligent local services. So through a range of local services delivering these things. But the important step here, Rosemary, is you need to actually have your positive test registered with the state to actually get into this system, and then answer and respond to the questions that you're actually asked to about how you're faring with regards to this. We are aware that there are certainly many vulnerable members of our community that may in fact actually getting sick and not necessarily reporting it, as the previous question said. And that's probably being a good citizen in your community. If you're aware of those people, is again, in fact, actually urging that case to go through the realms of actually notifying us, because they may actually miss out and they may be suffering at home unnecessarily. So we're very keen for the members of the community to actually look out for those other less fortunate than us members that may in fact be faring worse with this.
And Rob, another question for you. If someone I live with has symptoms and is waiting on a test, can I go to work?
Yeah. You're a primary close contact in that setting, and unfortunately, vaccinated or not, you're going to have to isolate. If you're vaccinated, fully vaccinated, that's 7 days at home and getting a RAT test on day 7 to clear you. It's got to be negative. So unfortunately, you're staying at home watching Netflix with them.
Okay. Rob, another question for you. If a household member has COVID, what can we do to minimise the risk of other household members catching it? And for parents of young children with COVID, how do they protect themselves while they are giving care?
Yeah, so all of us who've had young children know that we sent them off to childcare to come home with everything else. And of course, we always love to cuddle our young children, and we end up with everything that they've got, from the gastros to the colds to the flus, to everything else. And you can even find that you can get diseases you missed out in your childhood that you thought you'd had and you hadn't had, and your children give it to you. So this is really tough. What we have found is that people living in close, tight housing situations and crowded housing situations are spreading this virus very easily amongst all household members. And these continue to be challenges for us in controlling the spread of this virus. Now, the department website has some very easy to understand steps that you can take to minimise the chance of contracting this virus in your house. And I would urge you to look at that. Very easy to read, and also a lot of pictorial advice that you can actually look at as well. It's extremely hard not to catch a very infectious respiratory virus in the close confines of shared living expenses. So if you can actually place the person in an isolated place in the house where they don't share kitchen, bathroom, and living spaces, that's the ideal setting. But so many of us don't have the opportunity to do that. And it's almost inevitable that it will spread across there, especially with young children, because it's extremely hard to isolate young children from in fact, actually contracting the virus across. So, I guess, Rosemary, the answer to that is it's hard. There's some great advice on the website to help you. And it is possible. There are many people who have not contracted COVID in household situations. Ventilation helps, masks help, and cleaning surfaces helps.
Thanks very much. Another question for you, Rob, although I can also offer on this one, and it's a question that I think a lot of parents are wondering, which is, are schools likely to go back? And I'll commence the answer to that is to say two things. One is, today's the 19th of January. When we think about what we were doing 2 weeks ago, the world has changed quite a bit with relation to what we know about Omicron, what we know as a state, how we've responded, what that's meant for our state. And so that's a long way of saying that those decisions are made at the highest levels of government, taking into account all of the factors, the workforce factors, the risks, the impact on children, the impact on families, and those decisions will be made closer to the time. And anything else we said about that would be speculation, because none of us can see the information that people will have to hand this time next week where they can start making those kinds of decisions. I imagine that's exercising quite a bit of time at National Cabinet as well, because of course all children in Australia are due to go back to school in coming weeks. And I think that because the states vary in what they're dealing with, I think those sorts of things are getting a very hot topic around Australia. So Rob, a clinical question for you. Why are we eligible for vaccination now in 3 months, and does it stop working after 3 months, and will we need it again in 3 months' time?
Okay, so the challenge has been that we've had changes in variants. So the initial vaccines were developed against the Alpha strain, and the studies proved that they actually worked against the Delta strain. And then we had the Omicron strain. So we actually had to look and understand how the vaccines worked against that strain of the virus. And I'm pleased to say that 3 doses of the vaccine are very effective at reducing severe disease against the Omicron strain. And they are certainly 2 actually good against Delta. So the reason we're having the 3rd dose and it's come to 3 months is that we know that our antibody levels generated by the vaccine start decreasing by that time and significantly start to drop after that time. So as of this morning, the Premier has announced that in Victoria, that booster doses have been brought forward to 3 months after the 2nd dose. And what will happen in the future is still, again, hypothetical, I would suggest, that it's possible that we will need another boost. Well, I certainly think that this year we will need another booster dose, but it's a matter of actually what type of booster dose we'll need. And at this stage, there is the development of a mRNA vaccine against the Omicron strain that's coming on. And as I said, there are other vaccines on the horizon that are actually active against a multitude of variants. And we may find ourselves later on this year getting another booster dose that actually will cover multiple variants. Or we may find ourselves in the middle of the year getting another booster against the Omicron strain. And it really depends on what happens with the circulating virus and also the availability of these. But again, I can only say that I'm certain that you'll be getting another vaccine sometime this year that will cover the COVID. As for the effectiveness of the vaccine from there, you certainly do have residual immunity from any of the vaccines that you've had. It's just not at an acceptable level to actually prevent severe disease, which is why you're getting the boosters.
Okay. Thank you very much, Rob. One last question for you, Rob, which is, I tested positive to COVID and completed my 7 days isolation. When would it be okay for me to visit an aged care facility?
Yeah, like the answer previously with the mother with breast cancer undergoing treatment, the same question comes. People in aged care facilities are at high risk of having severe outcomes from the disease. Now, we've certainly worked at a region with our facilities to vaccinate as many of our aged care residents as possible. And I'm pleased to say that we've done a very, very good job with the assistance of not only the residents themselves, but also the wonderful staff at our aged care facilities. And that has saved a lot of lives in our region. So in one sense, if your relative in the aged care facility is fully vaccinated, that certainly means that it's less likely it'll spread to them. But you'll find when you visit the aged care facility, depending on whether they've got an outbreak or not, is that you may find you have to do a RAT before you actually can go into the facility and have a negative one. And you'll almost certainly be asked to wear a mask, and probably will be visiting them in a ventilated area rather than in a closed room. Those are the safe ways to actually do that. And I can assure you, after 7 days after you've done your isolation, I'd still be wearing a mask if I was visiting someone in an aged care facility. Not that I have the infection risk, but it's just to actually be that extra precaution with regards to that. And as much as you might like to get close with your loved ones at this stage, it's not the time to do that. And I, again, can empathise with everybody because I certainly have aged parents and my mother always likes to have a hug, but I'm rejecting her at this stage because I want to keep her safe because she's special to us. So I think in one sense, it's, just be a little cautious at these times, Rosemary, because, and we're not asking you to do it forever.
So Rob, one last question for you, which is, if there was one key message for our attendees today, especially in the absence of having access to rapid antigen tests, in order to keep ourselves and others safe and those we love and those we work with safe, what would that one key message be?
If you have symptoms, presume that it's COVID because we have a pandemic on at the moment and many people in our community have it. Isolate. And if you can't get a test and you've isolated for 7 days and you've improved, that's great.
Okay, and I guess that's complemented by that if it isn't COVID, it's some other respiratory virus, and we can keep our colleagues and family and loved ones safe from that virus too if we isolate as well. So there's been no harm done in the meantime. Well, that brings us to the end of our session tonight, and I hope that those who've attended tonight have found it useful. I'm very grateful to our Auslan interpreters, Paul and Gabriel. Thank you for your diligent and conscientious work. Thank you to our panellists for your expertise and your expert and concise answers. And thank you all to our attendees for joining and asking questions, which we know are probably asked by many others as well, and you've been able to elicit answers from us, which we hope answer and allay a lot of the concerns of the people in our community. Again, our thanks to you for attending. Any questions we haven't got to, we'll endeavour to have answers to, and they'll be on our website. And we'll also be having general Q&A sorts of answers that have come up thematically on our website also. So thank you for attending, and good night.